Hello, friends. Welcome to Cook to Nourish. In today's episode, I'm going to be talking about medications on RA, whether to take them or to avoid them. Now, this is a question that I get asked a lot by you guys. A lot of you, send me DM and direct messages asking about whether medications, whether they can go on medications, when they're doing diet, and whether just the AIP diet will be enough for them. And then also whether they might be able to wean off of their medications completely after they get better, at some point. So those are the kind of questions that I get. And I thought that this question is really, not a very simple yes, no kind of question. It's really complicated, and there are too many different, aspects to it. So I wanted to make sure that I communicated all those points to you clearly, and then you can make an informed decision regarding whether you should be going on medication or not. So I have prepared some content for you, and so let's get started. All right, so medications for RA, take or avoid, right? That's a big question. So let's see. I want to share with you first my reasons in terms of why I decided to go on medications or why I continue to take medications. So when, I added AIP to my AIP diet, when I tried AIP diet for the first time, I was taking medications, and my doctor at that time had told me that, the oral medication that I was on was not enough to get my inflammation under control, my RA under control, and that I would need to go on a biological or an injectable RA medication. And that's when I had decided to add AIP diet and try it. And within 3 months, I was able to see significant improvement. And basically, my inflammation levels went down from 56 ESR to under 20, which is under normal level, just within, the 3 months. And that surprised and pleasantly shocked my rheumatologist. So clearly the AIP diet helped me. But, and then down the road, 6 months later, I was also able to further reduce the dose of my oral medications. So now, considering those results, was I tempted to continue to wean off of medication completely? Yes and no. In a way, part of me wanted to be completely off of medications, but then I decided to still continue with some form of medication because of these three things. Number one, I wanted to really have an improved quality of life. Like, after my diagnosis for 2 years, I was in a state of a lot of pain, like endless pain, chronic pain that is also very intense and, like really severe. And I'm sure, those of you who are right now experiencing that pain related to RA, you know what I'm talking about. A lot of pain flares, and you just get from, one flare to another, and you just don't have like the energy or, quality of life in between. It's everything kind of, gets a setback. And that's why, for me, if I could be on medications and AIP diet and the lifestyle changes, and if they could bring me to remission, which is what they did, I was able to actually bring my RA into remission level where I, don't really have flares. So that was like, good enough for me, right? And then the second reason that I decided to consciously want to take some level of medication was because I was aware of this systemic damage that can result from RA. RA can actually attack the joints in your, not just the joints in your body, but they can also attack the tissues in your organs, like, heart as well as kidneys, etc. And so even if you don't have any externally, like pain symptoms or joint symptoms, you might actually have, some damage that might be happening inside your body, in your heart or your kidneys. And I know this firsthand because my mom actually suffered from this, and she passed away because of kidney failure that was related to her RA not being diagnosed or or treated. So because of that, I really believe that some level of control or having some form of immunosuppressant is a good thing to do. And to prevent the, as I told you before, because I was able to add AIP and lifestyle changes into the mix, and also do, some kind of taking care of root causes, like, addressing dysbiosis, as well as supporting the liver detox, and, improving gut health, etc. All those factors also actually help to reduce the inflammation. And because of that, I was able to prevent going into taking biologicals, which is what my doctor was intending or asking me to do. So I was able to avoid that. Plus, I was also able to reduce the dose of my oral medications. So those were, wins enough for me. And then the third main reason I was okay continuing to take medication was because I was tired of this endless digging, for root cause. Like when I said in the beginning that yes, to the answer that, yeah, I would love to be off of all medications and, go out and tell people that I was able to cure my RA completely. And you will find, videos like that here on YouTube. And I always am suspicious when people, say things like that a vegan diet completely cured their RA and things like that, because RA is a very difficult beast. And, any rheumatologist will tell you that. It is very different from other autoimmune conditions. And I, being a nutritional therapist myself now, practicing for the last 3 years, I help people, coach people to be on the AIP diet, as well as help them, or as well as recommend other supplements, etc., for them to help improve their gut health. And what I have seen is, many other autoimmune diseases like psoriasis or psoriatic arthritis, etc., can actually respond very well to diet and supplements alone, and eliminate the need for medications, but not as much when it comes to RA. It is really a difficult beast to tackle. And so although I would desire to be in that category where I could be off of all medications, but I knew that it was very hard and challenging. And then I was really tired. I think this third point is really, really important. Tired of endless digging for root cause. So think about it. I had already spent 2 years going from diet to diet, from doctors to doctors, alternative practitioners, naturopaths, Ayurvedic, homeopaths and whatnot, everything I was trying. And every time I decided to try something, I would trust the process and give it my 100%. And then it's so disappointing when you don't see results, right? So after having gone through that process for 2 years and not really seen a good results, and then finally, when I really began to get better with AIP and with, as I said, like, some work that I was able to do working with a naturopath on my gut health, I was at that point, I was like, really tired, because there's endless digging. Some people do this, and that's why I wrote this point, because I still have clients who are like really adamant that they will say that, no, I really would like to, get to the bottom of this and get rid of my RE completely. And I would, do you recommend that I work with another naturopath? Can you suggest any other person that I can work with, that I can continue to do root cause digging? And I feel like, of course, it's your personal choice if you want to continue to do that, but do give it some consideration as to what that does to your own mental health. And stress is a very important, reason or trigger for autoimmune flares. And I have personally experienced that too. That was one of the reasons I decided to quit my stressful job after I began to feel better, because stress could be a factor for, my causing a flare. And so that's with that reason, or with that goal of avoiding stress, I decided to put a plug onto this endless, digging and continuing to work and see what is, if I can work with another practitioner and see if my RA can be cured, right? Because I was like, okay, I am at this place right now. I'm happy, I'm flare free, I'm pain free. And only times that I do get a flare is when I go out of line. Like if I, either stop my medication, or if I, go outside of my diet that I'm comfortable with right now. or if something happens with relative to my lifestyle, right? So as long as those pillars are still there, I have a good quality of life. And that's why I decided to put a plug in there. Now, of course, I keep reading up, and if there are things, that therapies that come up or newer things that I feel like giving a try, I do. I do try. Like if I see that, infrared therapy can help, sauna can help, then I will go and give that a try, and that will help to detox, etc. But I have not continued to make that as a focus of my life, that to be cured of RA and to be free of all medications is not a goal in my life. And I told you, I hope I explained to you what those reasons are. So I just wanted to, make that clear. Of course, for you, it might be a different scenario, personally, depending upon what works or what does not work for you. For me, this quote really says it all, because what it says is medications almost always do it better if they are used in conjunction with other supports. And the point I wanted to make here is that for me, medications alone did not work, because they gave me a ton of side effects. They did not, reduce all my pain symptoms. My pain was still there. But when, along with those same medications, when I added AIP to the mix, when I added improved gut health to the mix, when I added lifestyle changes to the mix, that's when I, came close to remission. So it's, because I was able to avoid even the side effects of the medications, which is what I wanted to share with you. AIP diet has proven to heal leaky gut and reduce symptoms of autoimmune disease. It can actually reduce the inflammation levels in your body. There have been studies that have been done now in several autoimmune conditions like UC as well as Hashimoto's thyroiditis, which actually prove that the AIP diet can actually reduce inflammation levels. And I experienced it firsthand. I did see that. And these are the studies that they have been published now, and you can find details of these studies on autoimmunewellness.com under medical studies. So AIP in Hashimoto's thyroiditis, and here in this study, the women, half of the women on this study who were on thyroid medication were able to reduce their dose of medication after being on AIP for a period of 6 weeks. And again, in inflammatory disease, bowel disease, that is UC and Crohn's, clinical remission was achieved by 11 of 15 patients, that is 73% of study participants. So what I want to make a point here is that AIP works, right? And we also know that medication works. We know AIP works. And then further, I want to show you to you later is that when you bring these two together, then you get that synergistic effect. Let me, before I go there, let me first talk about the role of medications in RA. Now, when I talk about the medications in RA, I realize that there are, sometimes when I was talking about medications, I was only, I meant only the DMARDs, which are the disease-modifying anti-rheumatic drugs. Whereas there are some other medications too, that is your painkillers and NSAIDs, so non-steroid anti-inflammatory agents that are also prescribed for rheumatoid arthritis, to reduce pain and inflammation. So that's why I wanted to kind of differentiate between these two categories of medications, and further also differentiate between the oral medications and then the biological. So what are those, right? So the disease-modifying anti-rheumatic drugs are the drugs which actually help to reduce the immune mediator levels in your body that can actually cause that damage or inflammation in the joints, right? So that basically keeps your RA activity under control. It is trying to suppress those immune mediators that are causing that inflammation and pain in your body. There are two types, general categories here. One are like the oral or the traditional agents, which are oral agents. And they reduce pain and inflammation by suppressing the immune response. And further, they are oral medications. And so they are, not as strong as the biological or the injectable medications. Now, the biological or the injectable medications also do the same thing, reduce pain and inflammation, but they are highly potent. And because of that, the greater degree of immunosuppression, they can cause increased risk of infections. And there have also been reports that these agents can cause cancer with long-term use and can also cause other autoimmune diseases. So obviously the synthetic oral medications are safer to try. You should try them first because their level of risk or side effects is lower than the biological or the injectables. And that is the reason I wanted to stay away from them. And I am thankful that, I was able to stay on the oral medications once I added AIP into the mix. However, I don't want you to get the wrong message here. I am not in any way saying that asking everybody to stay away from biologicals. No, I would never do that, because different medications work differently in different people. So if you happen to be, somebody for whom none of these oral medications work to control your RA symptoms and reduce your inflammation, then you may have no choice but to go on to one of these biologicals, which is okay in my opinion, as long as you do all the other things that I'm going to talk later on in this presentation, which is to balance everything with diet and lifestyle. However, I wanted to kind of differentiate between these two. And these agents, can, in terms of their responses to the gut junction too, the oral medications have a greater chance of, loosening the tight junctions and increasing intestinal permeability. However, again, what you can do is there are things you can do to counter that. The AIP diet will help, as well as using certain supplements can help. Like methotrexate can cause, some gut GI kind of side effects. Some people have flatulence or, nausea kind of feeling. And what I have seen is by just utilizing some supplements that can actually heal that gastric mucosa, natural herbal supplements that can actually help counter the side effects of those. Okay. And so those are the main DMARDs, or disease modifying agents. Now there are other medications also used in RA, as I said, which are for painkillers, and these are your NSAIDs, or non-steroid anti-inflammatory drugs. And within this you have the traditional ones like aspirin and acetaminophen, sulfasalazine, ibuprofen, piroxicam, etc. And they have the dangerous side effects of causing gastrointestinal, like ulcers, bleeding, etc., if used for a long period of time. And this is a very important point that I want to make. Now, compared to the DMARDs, these NSAIDs do not do anything to reduce the immunosuppression, or do not cause immunosuppression. They do not reduce the immune activity. They don't do anything to that. They only reduce the pain and inflammation piece that results from the RA activity that causes, the joints to be in pain and inflamed. So they just kind of reduce the pain and inflammation. And even the selective COX-2 inhibitors, which your doctor may have prescribed to you, saying that they are a little bit better than ibuprofen in terms of the lower GI effects, like meloxicam and Celebrex, but they also have some other side effects. They have like increased cardiovascular risk if taken on a long-term basis. So that is the reason. So what I want to highlight here is, again, my message is not that you need to completely be off of pain medications and never take them. No, I'm never going to say that, because I have experienced pain, like real pain, for 2 years. And so I know what that feels like. And, there was a time in my life when I would be carrying like this big bottle of ibuprofen or Aleve with me in my bag, wherever I went, because, you never knew when I would have, like, the pain would hit me and I would need a painkiller. So I have been there and done that. However, what I would like you to know is that because of these side effects, they can further aggravate your leaky gut. It is important that whenever possible, try to avoid them. Like, so again, by doing all the other things, like by eating a healthy AIP diet and by managing your lifestyle, by doing other things to address your poor gut health, doing different things to improve your gut health can actually help to reduce inflammation and pain in your body, and thereby you can reduce your dependence on these NSAIDs. And the lesser you use them, that will further improve your gut health and reduce inflammation. So there you see, that's like a cycle, that vicious cycle that you need to begin to stop. Of course, you cannot like just do it right away. I understand if you're in a lot of pain, but kind of understanding that what it does to your body and how it can further aggravate leaky gut, and how doing the AIP and working on your lifestyle factors can actually help your inflammation, might actually help you to get off of these. And actually, the other thing, the drugs that I talked about earlier, the DMARDs, using the DMARDs on a regular basis can actually get you off of these medications completely, the painkillers completely. So, and that's a plus too, because these medications have a lot of side effects. And here I have some more detail on, how these NSAIDs cause leaky gut. What they do is they inhibit they open the tight junctions and between, in that mucosal intestinal lining, and therefore they kind of weaken that gut barrier and cause leaky gut. And they also increase the production of leukotrienes, which are incidentally mediators of inflammatory reactions. So they on their own can also further trigger inflammation. Now, what, again, as I said, balancing healing and quality of life is important. So as I said, like if you have no choice and you have a lot of pain, you do need to take painkillers. Yes, you should take them because it's not right to, live in so much pain. However, try to limit or reduce the dose as much as you can. And then try, one way that you can try to reduce your dependence on these are, as I said before, the diet, lifestyle, etc., right? And then also maybe you can explore natural alternatives like boswellia, willow bark, curcumin, which is derived from turmeric, is a very important supplement that I use regularly, and I also recommend it to a lot of my clients to help control pain and inflammation. And there are also certain essential oil blends that you can use, that you can apply externally, that can actually help reduce pain from your joints and help your symptoms. And then, as I said, it's okay to use if you need to, because, hey, it's important for you to have a good quality of life, right? Now, there's another medication that is also used in RA, and that is called as corticosteroid or prednisone. So I wanted to touch upon that also quickly here. So now that is also prescribed for acute pain. And, when I was first diagnosed with RA, that's the first thing my doctor put me on, prednisone, to reduce the pain. And, and that also actually suppresses the immune system. But again, it suppresses it very much, which can, again, give rise to infection because of the immunosuppression. And it can also cause other kind of reactions resulting from that cortisol production. It can cause weight gain, it can cause insomnia, and it can also cause, bone damage by interfering with the process there in terms of the calcium absorption. So it can cause osteoporosis. So this is again a drug, a corticosteroid, that is necessary in some situations, and it can be extremely useful in a flare and can be life-saving. However, there are again things that you can do trying to limit the side effects of it. What you can do is you can ask your doctor if there's nothing else that works for you, right? If the DMARDs are, alone are not working for you and you need to add prednisone, then maybe you can ask your doctor about alternate medication days. Like there have been studies which have shown that taking prednisone on alternate days can actually have reduced side effects. And then also very important is to avoid long-term use. Work with your doctor to see how you can taper off of these medications as soon as your inflammation is under control. And there are also other things you can do in terms of diet and lifestyle to balance, healing while you're taking steroids. Make sure that you eat more protein and omega-3 fatty acids, which can actually help your, weight gain that usually happens with steroid use, as well as to reduce that inflammation. And then make sure take additional steps to reduce stress. Maybe you can do yoga and meditation, etc., so that it can also reduce that stress that further aggravates inflammation. And also doing those things will also help you sleep better, because insomnia, as I told you before, is one of the side effects of taking steroids. So putting some other stress relief measures might help you in those areas. And then next most important thing that I want to cover is how AIP can help, right? So my whole point of this presentation is that medications along with AIP and along with lifestyle changes is when you see like the biggest improvement in health. And the reason that happens is because AIP and medications can work synergistically. And what does synergy mean? Synergy means that when two things combine together, the result of that is better than those two used individually alone. Right? So medications can cause leaky gut. And I experienced that when I was just taking medications, my inflammation was not completely under control. So when I was taking DMARD, I was still taking oral painkillers. Like I was taking ibuprofen and Aleve intermittently, because the DMARD alone was not able to control my pain flare. But when I added AIP was able to help heal the leaky gut and was able to reduce the inflammation. And medications cause nutrient depletion. That's the other important point. So when I was doing medications before without changing my diet, what that did was it actually was causing nutrient depletion and nutrients that was causing a lot of side effects. So by adding AIP, I was able to reduce those side effects, because AIP is such a nutrient dense diet. So gut healing with AIP. Now, other important thing is AIP does not just mean avoiding the non-AIP foods. It means it means that you need to add the important AIP foods that are nutrient dense. For example, organ meats, seafood like oily seafood, vegetables, lots and lots of vegetables. That's how you achieve gut healing. And then here I have a table that shows how, how the side effects of certain medications can be overcome by eating AIP foods. So for example, if you're taking painkillers like NSAIDs, they can cause nutrient depletions of coenzyme Q10, CoQ10, and glutathione. And taking AIP foods such as oily fish, such as salmon and tuna and organ meats, can actually help you overcome those nutrient deficiencies. Methotrexate commonly causes folate deficiency, and by eating AIP-rich foods that are rich in folate, like broccoli, Brussels sprouts, leafy green vegetables, liver, that can all help you overcome that folate deficiency. Steroids or prednisone can cause a lot of different deficiencies like beta carotene deficiency, B6 deficiency, folate, vitamin C, vitamin D, calcium, magnesium, potassium, selenium, zinc, a lot of minerals. All right. And again, just eating a nutrient dense AIP, like eating a lot of dark leafy greens, citrus foods, fish, shellfish, and organ meats can actually help you while you're taking prednisone. And the synergy here, this again, what I said before, but I want to reiterate. A nutrient-dense AIP diet improves digestion, absorption of nutrients, and reduces inflammation. Many people achieve remission through a combination approach when diet alone or medication alone isn't enough. So that's the point that I have been, saying from the beginning of this presentation today, is that how for me personally, when I just use medication alone, I did not see the results. It did not, make my pain go away completely. And at the same time, I was having a lot of side effects. But adding the diet or AIP was able to get me to remission. And then, lastly, I want to make the point that how AIP removes the body's toxic burden. Meaning, just because you eat so well, right? One of the things that we do by eating AIP is heal the leaky gut, as well as we support body's natural detoxing processes by giving all the nutrients that our liver needs to detox our body. And because we eat that way on AIP helps to remove the medication toxicity from your body. So if you're concerned that the RA medications, excuse me, like the DMARDs, can cause toxicity in your body, like methotrexate. You've heard that it's a very toxic medication. But when you combine it with AIP, your AIP is able to help you constantly detox, and thereby you don't experience as many side effects from those medications. And lastly, I want to make this important point that Dr. Sarah Ballantyne, this is Dr. Sarah Ballantyne's quote, which says that medication is not failure, right? Requiring medical intervention doesn't mean that you didn't AIP hard enough, but it also doesn't get you off the hook for making all those important healthy choices on a daily basis. What she's really important point that she's making here is, yes, medication is not failure. So taking medications is okay, right? But at the same time, just because you're starting back on medication does not mean that you should forget everything about diet and, kick the AIP out of your life because you're like, hey, I'm taking medication. Why should I mess with diet again? But she's also making those important point that they all work together. So, still controlling your diet, still eating healthy, still, taking care of your lifestyle, all those will actually help your medication to work better. For all you know, you might be able to even reduce the dose of the medication. So for me, the balance of medications, lifestyle changes, and nutrition has brought remission from RA, and I was able to avoid taking biologicals. I consider that as a win, right? So that is what I wanted to share with you today. I hope this video was informative to you, and that you can have important takeaways from here. Feel free to comment and ask me any questions that you have. All right. Thank you.